Okay, hi everybody, this is me, Andra. Tonight we're going to talk about lowering your risks about breast cancer. I have a special guest, a dear friend of mine, Kathy, that I met in the Mind Valley community. And we have her here with us. Kathy, she's been an oncologist, a PA assistant for more than over 40 years. She have experience with cancer patients, and now she's focusing her attention to teach us, and not just us, but teach people about health and mindset about holistic medication. Kathy, if you have something to add, go ahead.
No, that's good. So Andrea asked me to give a talk on breast health and lowering your risk for breast cancer. And I don't know how many of you know, but Andrea had breast cancer, and she has a real passion for making sure that women are aware of breast cancer and breast health. And she wants to spread the word to women on what they can do to lower their risk. So I'm really happy to be here explaining all of this to you. And what I'd like to do is, first I'm going to go over the function and the anatomy of the breast, and then some benign breast conditions, breast cancer, and then the BRCA gene, and then things that we can do to help decrease our risks. And after that, I'm just going to tell her story because I think it's very important that you hear her story, and then we'll open it up to questions. So let's first start with the function and the anatomy of the breast, because I think it's very important for every woman to know exactly what is in her breast. So many of us don't know. So I think it really helps when you're examining yourself if you have a feeling of what's in there. So as we all know, the breast function is to make milk. And so the breast consists of glandular tissue that makes milk, and also fatty tissue. And the breast size is actually determined by the amount of the fatty tissue, not the glandular tissue. The milk producing part of the breast is organized into 15 to 20 sections called lobes. And within each lobe are smaller structures called lobules. And that's where the milk is produced. The milk then travels through a network of tiny tubes called ducts. And the ducts connect and come together into larger ducts. And then the ducts exit through the nipple. And each nipple has about 9 milk ducts as well as nerves. The dark area of skin surrounding the nipple is called the areola. And the purpose of it is it contains glands that secrete a lubricating oil that protects the nipple and skin from chafing during breastfeeding, since that's the function of the breast is to produce milk and feed our children. And as many of us know who have breastfed, sometimes that oil isn't enough and we still do get chafing, but that's the purpose of it. The breast also has connective tissue and ligaments, which provide support to the breast and give it its shape. Please, everybody, please mute yourself so we don't hear any background noise. Thank you. And then nerves provide sensation to the breast, and the breast also contains blood vessels, lymph vessels, and lymph nodes. So first I want to talk about benign breast conditions, okay, things that occur commonly in the breast that are not cancer. The first is cysts. And these are just fluid-filled sacs that commonly develop in women around their 30s and 40s. The breast cysts can become tender, and if they become very painful or very large, they may need to be drained. And that's simply where a doctor just puts a needle into the cyst, draws out the fluid into a syringe, and they're supposed to send it to the pathology lab to make sure that there's no abnormal cells in there. But usually that takes care of the cyst, it goes away, and then it can come back. But sometimes they come back and they're smaller and you don't need to do anything. And sometimes they come back and get big again and you have to have them drained again. but that having a cyst does not make you at higher risk for having breast cancer. Cysts are very, very common. Then the second one is fibrocystic breast changes. And it used to be called fibrocystic breast disease, but it's not a disease. It's very, very common. And what it is in addition to the cysts, it's also fibrous tissue in the breast, which if you feel your breast, if you have this, your breast feels, the tissue feels thick and rope-like. And this is also very, very common. It happens in about half of women in their 20s to 50s will have these changes. It's rare after menopause, but it can happen, especially if women are taking hormone replacement therapy. And the third one I want to talk about is fibroadenoma, which is a solid tumor of the lobule of the breast, but it is not cancer. It has no known cause, and it's usually painless and movable, in contrast to cancer, which is a lump that usually is not movable. It's usually very fixed. Not always, but usually. Fibroadenomas occur most commonly in women in their 20s and 30s. And they usually stay the same size and may even get smaller, and some eventually disappear over time. A small number of them get bigger, especially in teenage years, or during pregnancy and breastfeeding, or if you're taking hormone replacement therapy in menopause. But a lot of times, once those hormone changes go away, they reduce in size again. And a fibroadenoma is usually diagnosed on breast exam and ultrasound. And if there's any uncertainty about the diagnosis, a biopsy will be recommended. Now let's move on to breast cancer. The most common types of breast cancer are listed here. When normal breast cells develop genetic mutations, they can grow abnormally and out of control, and then that's considered cancer. If left untreated, they can spread to regional lymph nodes that are in the area of the breast, and the blood vessels that run through the breast, and then spread to other organs of the body. When it spreads to organs outside the breast, it's called metastatic disease or stage 4 breast cancer. Breast cancer occurs mainly in women, although as you know, men can be affected too. And the most common signs are a hard lump, bloody discharge from the nipple, or changes in the skin, which I'll explain in a little while. So the first kind I want to talk about is DCIS, which is short for ductal carcinoma in situ. Ductal carcinoma in situ is when abnormal cells, when cancer cells develop in the ducts of the breast, but they just stay there. In situ means in its place. They only stay within the duct. They don't go outside of the duct. Women who are diagnosed with DCIS have a high likelihood of being cured. And it's actually very common. Then once the cells go through the wall of the duct and invade other parts of the breast, that's called invasive ductal carcinoma, okay? And that carries the potential of spreading to other organs of the body, or in other words, metastasizing. And invasive ductal carcinoma is the most common type of invasive breast cancer. Then we have when abnormal cells are in the lobule of the breast. Now, lobular carcinoma in situ has the word carcinoma in it, but it's no longer considered a cancer. It does not invade or spread. And so what happens is abnormal cells are in the lobule, but they don't turn to cancer, okay? But women who have LCIS do have an increased likelihood of developing invasive breast cancer in the future. And that's the fourth one, invasive lobular carcinoma. And this is when the abnormal cells in the lobule invade through the border of the lobule and then become cancer outside of the lobule. ILC usually does not cause symptoms or show up on a mammogram. It actually tends to be diagnosed as a result of a biopsy performed on the breast for another reason. And there are many other types of breast cancer, but they're pretty rare, and I don't want to confuse the issue and go into them now, but just so you know that there are other kinds. So now I want to talk about the breast cancer gene mutation, which I know many of you or all of you have heard about. So the name BRCA is an abbreviation for breast, BRCA, cancer gene, okay? There's BRCA1 and BRCA2, and they're two different genes that have been found to impact a person's chance of developing breast cancer. Now, you have to understand every person has BRCA1 and BRCA2 genes, okay? But they do not, even though they're called the breast cancer genes, they do not cause breast cancer. In fact, these genes play a big role in preventing breast cancer. What they do is these genes are programmed to repair breaks in DNA that lead to cancer. So if someone has a mutation of the BRCA1 or BRCA2 gene, you're not able to fix the damaged DNA, which means that those cells with the damaged DNA can go on to grow abnormally and become cancer. A small percentage of people carry mutated BRCA1 and BRCA2 genes. It's only of women diagnosed with breast cancer, only 10% have the BRCA mutation. People with the BRCA1 and 2 gene mutations tend to develop cancer at a younger age, and that you can pass that mutation down to your children. About 50% of women with either the BRCA1 or BRCA2 mutation have a very high chance of developing breast cancer before age 70. And breast cancer related to these gene mutations tends to be more aggressive and more difficult to treat and carries a higher risk of recurrence. So how do you know if you should be tested for these gene mutations? So it's all of these, if you have any of these situations, you should consider being tested. So the first is being diagnosed with breast cancer before age 50. If you or someone you know has had bilateral breast cancer, meaning breast cancer in both breasts. If someone's had breast and ovarian cancer, or others in the family have had breast, ovarian, or prostate cancer. If there's been multiple breast cancers in a family, if there are 2 or more primary types of BRCA1 or BRCA2 related cancers in, that should say 1 family member. If you're male with breast cancer, if you're an Ashkenazi Jew or of Dutch, French, Canadian, Icelandic, or Norwegian descent, they have a higher incidence. If you have a family history of pancreatic cancer or metastatic or aggressive prostate cancer, or you have ovarian cancer. So in any of these cases, you should consider being tested. And I live in Israel, where many of us are Ashkenazi Jewish descent, and there's a big push here for every woman of Ashkenazi Jewish descent to be tested. Personally, I don't know if I agree with that. I think, I like to go more with these situations that are listed here. I worry a little bit about if somebody is getting monitored regularly anyway, what knowing that they have the BRCA gene mutation will do to their psyche. I really worry if you're waiting every day to be diagnosed with breast cancer, what that does to you and to your mind. So I'm not sure how I feel about that, but anyway, I tend to go more with what's listed here. So now let's talk about what we can do to try and keep our breasts healthy. And one of the most important is the self-breast exam. So I'm going to narrate the exam and Andra is going to demonstrate. So first I want to tell you that it's very important to have annual exams by your family doctor, gynecologist, or breast surgeon starting at age 30. But self-breast exams should be done every month beginning at age 20. So you know you're normal and you'll notice quickly if there's been any change. Like I tell my patients, you know, if you're going to the doctor and the doctor feels something abnormal, you can say, oh, I've been checking my breast for 10 years. That's been there the whole time. And the doctor says, oh, okay, no problem. Don't worry about it. Or the doctor finds something and you can say, oh, you know, I've been checking my breast for 10 years and I've never felt that before. Then the doctor knows, okay, we need to check this out. So it's very, very important for you to know every inch of your own breast. If you're menstruating, you should check yourself after your period, since the breasts can have normal premenstrual changes that will go away after your period. To do a thorough exam of both your breasts will take about 10 minutes. Don't rush, okay? You only have to do it once a month, so take your time, because your breast exam could save your life. And believe me, Andra said, I've been in oncology for 40 years and I have lots and lots and lots of patients who found their lumps by themselves. No doctor ever found them. So they saved their own lives by checking themselves. So the first step, you're going to begin by looking at your breasts in the mirror with your shoulders straight and your hands on your hips. You're checking the size of your breasts. Now, nobody has two breasts exactly the same size, but they should be close. If one is much bigger than the other, that needs to be checked. You're checking for the shape of your breasts. If all of a sudden the shape is different than it's been, that's a sign. And you should check the color of your breast, the color of the skin. Notice if there's any distortion, such as dimpling or puckering or bulging. Okay, and sometimes you can see a little puckering, and what that can mean is that there's a nodule underneath the skin pulling the skin down and causing it to pucker or to dimple. You're also checking the skin for redness or a rash or swelling. Now, a rash is very important because there is a kind of breast cancer called inflammatory breast cancer, and it often is not associated with any kind of lump. All it is redness of the skin. So that if you see redness and it doesn't go away, that needs to be checked. So the second step is now to raise your arms above your head, and you look for the same changes. This raising your arms provides a new angle which may reveal something that wasn't seen in the first position. And this is very important because when you're, sometimes there is a nodule causing dimpling, but when you raise your hand above your, and you don't see it with your hands on your hips, but when you raise your hand above your heads, all of a sudden, bam, you'll see it. So it's very important to do both positions. Step 3, you're going to squeeze each nipple gently and check for any signs of fluid coming out of one or both nipples. The fluid can be watery or milky, yellow, or bloody. And if any of these fluids come out of your nipple, you need to have it checked. Of course, if you're nursing, and milk is going to come out, so that's, you know, obvious. But you shouldn't have milk coming out if you're not nursing. And if you're nursing and blood comes out, definitely get it checked. Sometimes it could just mean you have mastitis, which is inflammation and infection of the breast, but it needs to be checked. There are women who have been diagnosed with breast cancer while breastfeeding. Then the fourth step is to lie down on your back, and you're going to use your right hand to feel your left breast and your left hand to feel your right breast. And of the side that you're checking, you're going to raise, as Andra's showing you, you're going to raise your hand above and behind your head. And then with the opposite hand, you're using very firm, smooth touch with the flat part of your fingers, keeping the fingers together. You're using a circular motion, and you're covering the entire breast from top to bottom and side to side, meaning from your collarbone to the top of your abdomen and from your armpit to your cleavage. And you can go in concentric circles, or you can go up and down, or side to side, side to side. First, you want to use light pressure over the entire breast. And then you're going to go over it again with medium pressure to check for the middle tissue of your breast. And then you're going to use firm pressure all the way down to the chest wall to check for the deep tissue of the breast. Any lumps you find should be checked by a doctor, especially, as I said, if you've been checking yourself regularly and something new has appeared. Many lumps are rubbery and movable, and those are most likely to be cysts. However, lumps that feel like a frozen pea of any size, but hard like a pea, needs to be checked immediately. It doesn't mean it's cancer automatically, but it needs to be checked because it could be. There are normal changes that occur to the breast over time. Young women usually have very dense breasts, but as we age, the lobules are replaced by fat. The breasts are very responsive to hormones in the menstrual cycle or when using hormone replacement therapy during menopause. Before menses start, the breasts may swell and feel tender or slightly lumpy. By menopause, most women's breasts are completely soft. This can make normal lumps more noticeable, so if you feel something different, get checked. If you're told that the lump or lumps are normal, then you'll have a new baseline for comparing. Your breasts may feel and look different when you gain or lose weight, but if you have any concerns, check with your doctor. Next is breast imaging. And this is done to check for breast cancer because studies show that 92% of women in whom breast cancer is detected early will recover. Mammography is a type of X-ray. Your breast is flattened between two plates of plastic or glass, and then the X-ray is taken. Usually the breast is put into a few different positions so the radiologist can get different angles and views of the breast. It can be a little uncomfortable, but it's only for a few minutes and well worth the discomfort. It's recommended for women to begin having mammograms from age 50 or earlier if you have a family history of breast cancer or you've been tested positive for the BRCA gene mutation. And some countries recommend mammography from age 40. And then some, it depends on the year. Sometimes it's recommended every year, sometimes it's every 2 years. It goes back and forth. You check with your doctor and they'll tell you when you should be checked. Personally, like in Israel, we're told after 50 to go every 2 years, but I happen to have very dense breasts and I'm an Ashkenazi Jew, so my doctor says no every year. Plus, I not only have a mammogram, I always have an ultrasound also. So next is ultrasound, which is an imaging technique that uses sound waves to create images of the breast tissue. The ultrasound can reveal the tissue composition as well as the blood flow. It's very painless and it adds a lot more information to the mammogram, especially in women with dense breasts, because you can see things that are very difficult to see on mammogram. When you have dense breasts, the tissue is it's like a big whiteout on the mammogram and you can't really see lumps. So ultrasound really helps. And then the other is MRI, or magnetic resonance imaging. And this provides the clearest, most detailed pictures of the breast. It creates 3D images, and MRI is used in either screening for high-risk patients, staging of breast cancer, checking it for treatment response once somebody has had breast cancer and is getting treatment, or before they have surgery for their breast. MRI is much more expensive than mammogram or ultrasound, so that's why it's not done on a routine basis. So now what else can we, besides checking ourselves and getting our mammograms, what else can we do to lower our risk? So the first is limit alcohol. Alcohol can increase the levels of estrogen and other hormones associated with hormone receptor positive breast cancer. Some breast cancers they grow in the presence of estrogen, and some don't rely on any estrogen, but that's a whole nother subject. Alcohol also may increase breast cancer by damaging DNA. So compared to women who don't drink at all, women who have 3 alcoholic drinks per week have a 15% higher risk of breast cancer. The next is cigarettes. A study published found that smoking is associated with a significant increased risk of breast cancer, especially in women who started smoking during adolescence or who have a family history of breast cancer. And you need to control your weight. For women, being overweight or obese after menopause increases the risk of breast cancer. Having more fat tissue can increase your chance of getting breast tissue by raising estrogen levels. Estrogen is stored in our fat. Also, women who are overweight tend to have higher levels of insulin. And insulin happens to be a potent hormone that activates many pathways that drive aggressive breast cancer biology. We want to be physically active. There are many studies have shown that physically active women have a lower risk of breast cancer than inactive women. In 2016, 38 studies showed that physically active women had a 12 to 21% lower risk of breast cancer than those who were less active. Breastfeed if possible. Research shows mothers who breastfeed lower their risk of breast cancer, especially if you nurse longer than 6 months. Most women who breastfeed experience hormonal changes during lactation that delay their menstrual periods, which reduces a woman's lifetime exposure to estrogen, which, as I just said, can promote breast cancer growth in some types of tumors. In addition, pregnancy and breastfeeding, during pregnancy and breastfeeding, women shed breast tissue, which helps remove cells that may have some potential DNA damage. Limit dosage and duration of hormonal therapy. And I also want to mention here the birth control pill. An analysis of data from more than 150,000 women who participated in 54 studies showed that overall, women who had ever used oral contraceptives had a slight 7% increase in the risk for breast cancer compared with women who never used the pill. That's also another thing that changes every year. Different studies come out and it's constantly changing. However, combination hormone replacement therapy, meaning estrogen and progesterone used together in menopause, increases breast cancer risk by about 75%, because as we get older, our risk for breast cancer increases. So if you're exposed to hormones at an older age, your risk goes way up. This is even if it's used for a short time. It also increases the likelihood that the cancer may be found at a more advanced stage, as well as increasing the risk that a woman diagnosed with breast cancer will die from the disease. Breast cancer risk increases the most during the 2 to 3 years of taking combination hormone therapy. Higher dose combination therapy increases breast cancer risk more than lower dose. The risk goes back down to average about 2 years after you stop taking the hormones. And estrogen-only hormone therapy increases the risk of breast cancer, but only when used for more than 10 years. Now, I want to continue with this idea of prevention, and I want to tell you some very interesting research that was done by a woman named Kelly Turner. She interviewed hundreds of people with terminal cancer and other serious diseases who made lifestyle changes and ultimately beat their disease. She identified 9 factors that were common among all of these people. After she completed her research, she went on to write about them in her book, Radical Remission, which was published in 2015. So when I heard about this book, I said, you know, why should we be waiting until we get cancer to find out what these 9 factors are and then work backwards? Why don't we start, you know, living these 9 factors before we get cancer and prevent disease? So that's why I want to talk about them tonight. So the first is good nutrition. Greatly reducing or eliminating sugar, meat, dairy, and processed foods. Greatly increasing vegetables and some fruit. Eating organic, and drinking filtered water. She found that these were a common nutritional guidelines that all of these people did. And she interviewed hundreds of people. It's really amazing to think that there are hundreds of people who have cured themselves of stage 4 cancer. Why we don't know about these people more is, I don't know, but now her book is getting more and more popular. So I'm hoping that more people will learn about it. The second she's found was that people who survived learned to take control of their health. Be willing to analyze your life and make changes in your lifestyle. Learn how to do research about maintaining good health or about any health problem you may have. Let your doctor know of your preferences and be willing to change doctors if your doctor doesn't listen to you or you don't have a good relationship with him or her. It's also, many of these people incorporated other types of healers such as acupuncturists, naturopaths, psychologists, nutritionists, energy healers, massage therapists, etc. It's not just conventional physicians. Following your intuition was a big one. Your body wants to be whole and it knows how to be whole. You just have to learn how to listen to what it's trying to tell you. It has an innate wisdom and innate power to heal itself. You need to learn how to be still and tune in. And there's lots of ways to do this. And she goes through this in her book. Then there's a lot of people took herbs and supplements. The idea here is to make the body as unfriendly a host for cancer as possible. There are many herbs, vitamins, and supplements that can, for instance, help optimize your immune response, replace vitamin and mineral deficiencies, help rid your body of toxins, help reestablish your gut microbiome, and many other things. Everyone is different and every person needs different herbs and supplements. It's important to see a professional in this area, such as an herbalist, a nutritionist, a naturopath, or functional medicine doctor, who would test you to see which ones are best for you personally. The next is releasing suppressed emotions. It's very important to deal with current and past emotions such as anger, frustration, stress, fear, regret, and grief. They can be held in the conscious or subconscious mind and then affect our physical health. There are many ways to release them, including psychotherapy, hypnotherapy, like what Andra does, energy medicine, and energy psychology. And increasing positive emotions, which can be done by starting a gratitude journal, volunteering, practicing random acts of kindness, forgiving someone, and showing compassion. Do things that make you happy and the other people in your life as well. And she also found that being part of a community was very healing. And there are many studies backing this up, showing the positive effects on the immune system when we have the support of a group and we feel that we're part of a tribe. Humans are naturally communal, so our bodies work best when we're in that type of environment. And also a spiritual connection. This means going beyond our ego and considering the existence of a universal intelligence that pervades and unites all beings and all things. And having a strong reason or reasons for living. It's thinking about what gives your life meaning. Why are you here? What are some things that you want to learn about or do during your lifetime? What are your goals and how do you want to help contribute to the world? So I'm not sure if you noticed, but only 2 of these factors are actually physical, the diet and herbs and supplements. The rest are emotional or spiritual in nature. Never underestimate the importance of the mind-body connection when it comes to health. And I don't know if any of you saw it, but I do have a webinar on YouTube on the mind-body connection that Andrea posted. She posted the link on the Building Happiness Together Facebook page if you're interested. So that concludes my talk. And now we're going to hear about Andra's story, which is really, really inspirational.
Thank you, Kathy. Thank you. Wow. So my story, well, my story is the typical one. So I think it is when I felt a lump on my 33rd birthday, and it was quite quite strange, to be honest with you, because you know it was a celebration and not something to look forward. It's like Kathy said before, it's very important for us to check ourselves. I did felt the lump on that day, which was a Saturday, and on Monday I called immediately my practitioner and asked for an emergency appointment. I heard so many other stories that because they are afraid of the word cancer, they do not go to check. To be honest with you, I didn't even thought of the cancer. I just wanted to check. What if? I didn't want to live with what if for such a long time. I was like, no, whatever it is, I wanted to check. And I did check myself, like Kathy showed us the method, but I didn't felt anything. I didn't had any symptoms, like all the symptoms that they asked me, I had nothing. And Kathy said before that we actually do not have symptoms in breast cancer. So the most important factor is us. It is up to us to feel, to know our body, to be aware of the changes in our body, because if you are not aware, nobody else can be aware. So just take 10 minutes of your life. It's not a lot. 10 minutes, it's 2 stupid videos of cats doing silly stuff on YouTube, and I think it's just worth your life to be saved in case you have cancer. So just check yourself. If you feel like you don't have anything, just go further and further, because I didn't feel anything, and my doctor said I had cancer for the 3 years previous to the one that I found, because I had 3 tumors in my breast, 2 in my breast and 1 in my underpit, underarm. And I was thinking, wow, I lived 3 years with cancer without me having symptoms, and I felt guilty and I blame myself that I didn't check thoroughly, I didn't push harder. And obviously, like Kathy said, when we are menstruating, the body's changing and you feel this might be a lump or it's because of menstruation. Just go to the doctor, no matter how silly the thought is, oh, but it's nothing. If you feel insecure and if you feel like the lump is there for a certain while, just go to the doctor. Don't wait. Don't do the same mistakes that I did, you know. And I'm the lucky one. I'm so grateful that I had cancer, because the universe pulled me from the life that I was having, which was not very, very good. The one I was in, falling down the rabbit hole a lot. And then me having cancer made me realize that, oh my God, I can have a different life, and why do I have to be a victim anymore? And I can be happy and joyful. And now, because of the cancer, I can help other women, and I can bring this to the surface, because it's not such a topic. It's, oh my God, check yourself. How many of you did actually do that in your life? I have never done it before that. So I was 33 and I was doing, let's say I was looking at my breast for like what, 2-3 months before I got cancer, just because another relative of mine got cancer. So that freaked me out. So I started doing it. And even with that, I didn't feel the big lump. So I really, really want to press on this issue. Check yourself. It's just 10 minutes a month. It's very easy to do. You don't need to go to a doctor for that. You can do it at home while you're taking a shower, for example. It's just the same thing. While you soap yourself, just feel your breast. Give yourself that pleasure. Know your body. Listen to your body. And the one thing that I want to press, just be your own advocate. Go to the doctor. And like Kathy said, if you think that you don't get the service that you think you deserve, just go to another one. Press for you, because it's so important to be your own advocate. to trust your gut, because your body, you know your body better than anybody else. So just do that. Check yourself and then go to the doctor the moment you feel something unusual. Don't wait. I heard stories that they waited and waited and it was too late. They were having metastatic cancer and there's nothing they could do. And I had a friend that she was breastfeeding and she felt a lump, and she waited until I got diagnosed with cancer until she went to the doctors to be checked out. Luckily, she was just having some hormonal imbalance, and like Kathy said, she had a cyst, so they took it out, and she didn't even need surgery. But don't live under the fear of the world. Cancer is not the end of the day. It's not the end of your life. It's actually the opposite. It can be your rebirth. It can be, I don't know, whatever you want to be, in a different kind of light, in a positive light. Or it might not even change you, but at least it can save your life. So just please do that. Check yourself and go to the doctor. I can talk I can talk more and more about my story, but if you guys have any questions, let's do that. Just don't be afraid. Switch on and off your mic. If you want to switch your camera on, it's fine. If not, just that. Or if you want to type it in the chat room, that's fine as well.
Andra, you brought up a good point. I'm sorry that I missed that, but when you're checking yourself, please remember to check in your armpit. Like, the best way is to lower your arm a little bit and really dig up inside your armpit and mash around in there and feel for any lumps. Some of us have little lumps in there, but you're looking for, something new or something hard. But it's very, very important. Some women don't feel the lump in their breast. They only feel the lump in their armpit, and that can be breast cancer. So that's very important.
Somebody.
Oh, sorry. I just wanted to say quickly, thanks so much for the presentation. Amazing. That was so useful. There's so much information there I didn't know about, and thanks for walking us through all the types of non-cancer conditions as well. I didn't realize there's actually so many. Andra, your story is incredible, actually, and I think I'd like to hear more about how you managed, overcoming that. And I think someone also asked in the chat as well, if you can tell us how you did that.
So I'm gonna just answer quickly to Joy, because she asked how often. Once a month, like Kathy said, it's sufficient, but obviously you can do it as often as you want. It's up to you, but like Kathy said, I think once a month, to just check, to know your body. Start it once a month, and if you feel something unusual, or if you feel like before menstruation and after, just do that. How I overcome it? Well,
no, Andra, wait, I just want to interrupt you for a second. Joy wrote, how often do we go to the doctor for an exam? And that's once a year is fine. Okay. And Wendy said, do you need to take any hormonal therapy after treatment? That's a complicated issue. So that after chemotherapy, women who have estrogen positive breast cancer, means their tumors grow in the presence of estrogen, will be put on an anti-estrogen medication after chemotherapy. Which one depends on whether they're premenstrual or post or they're menopausal. So, okay, go ahead.
To answer that to Wendy, they induced my menopause because my cancer was ductal C2 type 2 to stage 2 to 3. So they induced me into menopause because I had more estrogen in my body. I had HER2 positive as well. How I overcome cancer? Well, I was really blessed, and I'm still blessed and grateful, and I have no words for all the friends that they were close to me, as I have no living family members, and I had all the support that I needed. The only thing that I didn't, it was during the nighttime, but other than that, I was so spoiled rotten. And it gave me a chance to get closer to some of my friends, and obviously some of my friends we had to say goodbye because we went in different roads. But I overcome it by being positive, by laughing, even in the silliest times. One of my friend, for example, which is she's here tonight, she said to me, well, if you're not gonna have the nipple, you can have a transplant, but be aware to not have a man boob, you know. So that made me laugh and forget, and I was always positive, and I was always, even now I take the life, it is what it is. I'm not gonna hide, I'm just gonna move forward. And I realize now that this is me being so positive. It actually gave me the strength to go through it. And even when I was really low and I had my moments when I wanted to die because I was in so much pain, I was thinking of that sunny days. I was always picturing in my mind, you know, the laughter, and I was watching comedy, a lot of comedy, constantly stand up. I had 2 favorite shows that I knew it by heart. I was always in contact with people. I did hide for a couple of days because I didn't know how to react, and I was still in shock. But like Kathy said, the community is very important, and I didn't know at that time because my pain was so huge that the whole street was filled with my pain. And I realize now that after I've been in that situation, I'm in group support with other people, and I realize how important it is for us when we are in that moment to have this kind of support, because nobody from my world understood my pain. And I was stubborn and I didn't want to listen to look for a community when I was in that pain. And I think that's a reason that I regret, but it is what it is. And I'm just being happy and laughing all the time and spreading joy to the world. And I don't know, this is how I overcome it. I didn't do anything particular, which I'm doing now, but then I had no information about that. I was just being myself, surrounded by the love, by the people that I had around me. And I have no words to thank each and one of them for all the love and support and the care that they showed me. And I could never repay them back just by saying them I love them. That's the only repay that I can give them.
That's amazing. I wish I had your optimism, Andra. Yeah, we wish we had that. You know, they say there are 2 types of people in the world, the pessimists and the optimists. And yeah, I think that definitely helps us as well to have you around.
Thank you. I give you all my love and sunshine when I have it. I'm not keeping it to myself.
True. I did have another question, if that's okay. Of course, if nobody else wants to go online. It's actually for Kathy, and I'm wondering more about healing methodologies for breast cancer. You know, you mentioned some other, so you mentioned various ways of treatment, like alternative methods. And from your experience, what seems to work the best? Because I know we live in a world now where there's so many treatments, and you know, it's not necessarily like 20 years ago when, wow, you were diagnosed with cancer and that was it. So would you mind speaking a bit more about that?
Well, to tell you the truth, you know, everybody's different. So it's really hard to say that there's something across the board. You know, two different people can take the same herbs or the same supplements, and one person will respond beautifully and another person it won't respond at all. Same with chemotherapy. You know, 2 people can take the exact same chemotherapy regimens, and one person will go into complete remission and another person will progress. Their disease will progress. So it's really hard to say, and everybody has to do what, like I said, you know, use your gut. Go by your intuition is what's right for you. But I always encourage my patients to explore all different options and try to just see what made sense to them or what helped them. I come from the conventional world, so all my patients, you know, got chemotherapy. I don't remember too many people who didn't get chemotherapy. And, you know, And I can't say to you, oh, this person didn't get it. They did this, this, and this, and they were cured. But in this book, Radical Remission, that's why I showed it, because she, like I said, she interviewed hundreds of people with stage 4 disease who used all different kinds of methods, and they healed. And a lot of them started with chemo, then stopped it, or they didn't get conventional treatment at all. But I'll give you, and I'll give you another example. There's a woman named Sarah Ann Rothberg that I know, and she had stage 4 breast cancer. They told her to go home. She had tons of chemotherapy and multiple surgeries. And her disease kept progressing and progressing. And they told her to go home, get her affairs in order. And she was going to go on hospice, and she had a little girl, and she said, hell no, like I'm not dying. I can't die. I can't. She's divorced. She just went through a terrible divorce. She said, I can't leave my daughter. And she had heard of Norman Cousins, who was a journalist who had a disease called ankylosing spondylitis. It was a very painful, debilitating disease. And he was taking medication for it that was giving him a lot of side effects. And he decided to boost his immune system with vitamin C and watching comedies. And he used to watch funny movies every night, and he healed himself. So when she remembered that, and she started doing that, she started watching funny movies every night, and she started holding comedy parties in her. When she got chemo, she would invite, this was, no, so I guess it was before she finished chemo. She would invite comedians to come into the chemo room, and she would bring like cider and desserts, and they would have parties. And the doctors would also stay and party with them. And she healed herself. She also took some Chinese, she got involved with Chinese medicine also. But she's been 10 years clear of cancer after being told to go home on hospice. So, it's different for everybody. Everybody has to find, there are alternative treatments that work, but it's hard to say that this works for everybody. It just doesn't exist. Everybody has to find their own way.
But from my point of view as a patient, I think this kind of information we are completely lacking in. We're just being treated with conventional medication while they completely disregard the holistic one. I didn't receive any information regarding all of this. So everything that I've known and all the information that I got regarding holistic medication, Chinese treatment, all this yoga, mindfulness, meditation, they have arrived to me after I got the chemo, after I got the surgery, after I was not a patient anymore, basically. And it's like Kathy said, you can't say this worked for me. Me stopping the treatment worked for me, but I can't suggest this to you because you are different and your body reacts different. So you have to try everything, and that thing that works for you, it's wow, it's amazing. But we have to try it. You don't have to say, oh my God, I did this is not working, I'm gonna give up. No, this is not working, but there are like hundreds of other methods that they might work. Kathy Yonela has a question for you. You mentioned that men can also have breast cancer. I have a friend who has a lump on his chest. He was told it's fat, but it has slightly increased since. Could it be cancer?
It definitely could be. If it's gotten bigger, it could be. If it's just fat, it could be what's called a lipoma. It's just a very benign tumor, fatty tumor. But if it's gotten bigger, he can ask to have a biopsy done. It's not a big deal. Can even go to a dermatologist, a skin doctor, and ask the skin doctor to remove the lump and send it to the lab. So no, I wouldn't fool around with it. If it's changed in size, it should be checked.
If any one of you has any more questions, please do it now. Joyce said that, does progesterone raise your chance of cancer?
Right, and I think there's a lot of conflicting studies, but as I said, in the combination hormone treatment, the estrogen plus progesterone seems to have a worse effect on cancer risk than just estrogen alone. So I think that it does, but a lot of the studies with the hormones is a lot of conflicting evidence. It depends on the year, what's in vogue in that year, of whether you can take hormones or not. I mean, I know patients that are with estrogen sensitive breast cancers who doctors give them low doses of estrogen for, menopausal symptoms, and they feel comfortable doing it. So, and some doctors who won't even consider giving estrogen. So it's hard to say.
Wendy, she just posted a link about Truth About Cancer, which is full of information about holistic treatment and prevention.
Right.
Thank you so much, Wendy, for that.
It's a whole video series. Awesome. Yeah, he did a lot of research. He went all over, I forget his name, he went all over the world interviewing people.
Yeah, thank you so much, Kathy. If none of you have any more questions, I really appreciate you taking your time. Paula has a question.
Oh, Paula, oh, you have ankylosing? Wow. Wow, oh, you got it.
Paula,
I do have it actually.
His book. Norman Cousins' book is called Anatomy of an Illness.
Anatomy of an Illness. Let me write that down, actually.
Yeah, I think he has a few books, but that was, I think, his first book, Anatomy of an Illness.
Amazing. Thanks for that. What a synchronicity. Yeah.
Also,
I have it as genetic. Yeah.
No, Sarah Ann Rothberg started, when she healed, she started something called Comedy Cures Foundation. And she has a line, it's like 1-888 ha 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 or something, and where you can dial it and hear a joke. You press 1 for a
oh my God, I should do that.
And 2 for an amateur comedian, or so where you just call. But now with Netflix, I mean, just take time out a couple times a week and make sure that you watch a funny movie or a stand-up comedian or something,
Paula, I can hook you up.
My God, yeah, I need that. I need that. My life is so serious right now. I need
Paula, every time you feel in the mood for a joke, call me, because I have those at hand all the time.
Absolutely.
And in Romanian, they sound even better when you don't translate them. So yeah. So thank you so much, my lovely ladies, for tonight, for giving me your precious time. And thank you, Kathy. You are fantastic. And
thanks. And also, anybody, I'll write in the chat. My email is just kathy.poodiack@gmail. Yeah, but if anybody has any questions, please feel free to contact me.
Thank you as well, ladies, for your time, and I'll catch up with you in private next time. I'm really hoping you guys can send me some feedbacks for me and Kathy. What can we improve? What we should have talked more about, and things like that. Thank you a lot.
That you wanted. Any other topics you'd like to hear?
Yeah, exactly. Same. Thank you so much, ladies. This was a wonderful. You made my day, and I love you. I love you all as well. Thank you. Bye.